One example was hypertension control levels, which is a HEDIS measure, and that we were able to demonstrate that our African American population, when we first started that journey nearly 15 years ago now, our African American population had control levels of their hypertension that were just below the 90th percentile, which is kind of our acceptable standard, 90 percentile or better, and big gaps between them and other demographic categories of population. With the work we put in place to make sure that we educated people, that they were practicing appropriate protocols in terms of the appropriate medications, titration, that they were gaining patients' trust through culturally responsive care and engagement, and that where it was necessary, innovating the way we perform the care. So we recognized we were making great headway with African American women in controlling blood pressure, but our numbers were not advancing as fast as we would like them to because African American males were reluctant many times to come into the clinics from working or lack of trust or whatever the issue was. So some of our physicians pioneered some work in our regions to go to the barbershops. And where the men were gathering on a regular basis and gain support with the owners of those barbershops to use that setting as an educational center and actually measure blood pressures for our members and non-members to help them understand and appreciate the importance of controlling blood pressure to avoid strokes and other cardiovascular catastrophes, and leaning in on the emotional element of it, about you being a provider for your family and how important it is that your health is at a high level. So all of those type of things allowed us to demonstrate we could close those gaps. So within a 7-year period, not only did that community of our population go beyond the 90th percentile, we actually demonstrated we could close the gaps.